You're listening to the Future Tech Podcast with Richard Jacobs. Future technologies such as artificial intelligence, stem cells, 3D printing, gene editing, Bitcoin, blockchain, the microbiome, quantum computing, virtual reality, and exploring space are much closer than you might think. In fact, many early versions of these technologies are in play right now, and the companies that are using these technologies are the focus of this podcast. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a thorny medical problem. Remember, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you've enjoyed the podcast, please listen, subscribe, like, and tell your friends about it. Thank you. Hello, this is Richard Jacobs with the Future Tech Health Podcast. My guest is Nadine Artemis. She's an author and a founder of Holistic Dental Care. That's the book, The Complete Guide to Healthy Teeth and Gums. She's also the creator of Living Libations, a line of serums, elixirs, and essential oils for those that are looking for pure botanical health and beauty products. Nadine, thanks for coming. How you doing?
I'm good. Thanks for having me on.
Yeah, what led you to write a book about dental care? Seems like, for some people, an obscure topic.
Yeah, well, it's kind of an obscure topic, but on one hand, should it be? Because we all have teeth and mouths, and we're trying to figure out how to not, have cavities and fillings and root canals. But yeah, it is obscure, and it's maybe even further obscure because I am not a dentist. But that is where I found a gap in how we care for our teeth. When I was delving into my research in my 20s, I was doing a lot of research on health in general. And I did find, while you could find a lot of things about the body and a lot of different holistic methods to care for whether you had a headache or a stomach ache or different methods, I found that there was a big gap in oral care. And at the same time, the health of our mouths really is connected to and really reflects the health of our bodies. So I found that I needed to know how I could care for my teeth, how I could avoid issues, or where did these issues come from. So I found that because I needed that, I was pretty sure, the other millions and billions of people on the planet with teeth might also need to know what's going on.
Well, what are some of the things that affect people through their mouth that they don't know about? What are some of the links?
Well, I think one of the things that's really important for us to understand is, I can say that the teeth are connected to the rest of the body, but I think we kind of need to understand it a bit more so that we can see how issues are created. And I think most of us in North America have grown up with the thought that, you got to brush your teeth twice a day, visit the dentist twice a year, and things like acid and sugars sitting on the teeth are the root cause of all cavities. But it's actually more interesting than that and more nuanced than that. And it's not really the issue of sugar and acid sitting on our teeth. The teeth are connected in a much more systemic way. And the main thing that it's really great for all of us to understand is that the teeth are kind of like tree roots, or they bring up the roots of the teeth, bring up nutrients into the teeth, just like the tree roots bring up nutrients from the soil. And these nutrients that come to the teeth via the blood system, once the blood enters the tooth into the pulp chamber, it actually turns into a dentinal lymphatic fluid. And it's this lymphatic system that is really key for us to know about, so that we can understand how teeth can stay strong and healthy. And so this lymphatic nutrient dense fluid comes up into the pulp chamber, and then from there part of the tooth called odontoblast shoots that up onto the surface of the teeth, where it is like microscopic sweat. And this fluid coalesces with our saliva to prevent cavities, to take care of the mouth's microbiome, the microbiome being the balance of bacteria in our mouths, of healthy bacteria, not just pathogenic bacteria. And this method is what I like to refer as the invisible toothbrush, because of course our bodies were designed with a way for the teeth to take care of themselves, right? We weren't just, our body is to help with that system, not just toothbrushes and toothpaste. And so when this lymphatic system gets challenged or suppressed through things like spikes in blood sugar, a lack of minerals in the diet, stressful hormonal times like pregnancy or teen years, also just like a poor diet in general, or chemicals. All of these things can suppress the lymphatic flow so that it actually stagnates, or the worst case scenario is that it actually reverses. And so then the teeth, rather than being these like trees drawing up nutrients into the tooth, this lymphatic system reverses, and then the teeth kind of become like a straw, and they suck in viruses and bacteria from the mouth into the tooth once this system gets reversed. And that's actually the genesis of decay.
Well, how would this happen if the blood supply is coming in through the interior of the tooth? How does it migrate through the enamel to the outside of the tooth?
So, some of that's through the internal forces in the body, which are the odontoblasts. They actually act like little pumps, and that pumps it out. But so through thousands of studies, the main dentist that discovered this, because he realized that the teeth must be connected to the body. So he did like decades of research on this process, and he actually used X-ray fluids so he could see what happens when we chew food. And then he realized that the chewing of the food through substrates and enzymes signals the hypothalamus, and then the hypothalamus signals the parotid glands, which are in the mouth on either side of the jaw, and then that signals the digestive system. And so when we're eating this fluid, it takes an hour. It takes minutes for them to track this system through X-ray fluid. And then interestingly enough, it actually takes an hour from when it's reaching the root to get to the surface of the teeth. So it's traveling through the body doesn't take long, but then that final process is actually a really long, complicated part. And the inside of our teeth are fascinating. I mean, one molar has over 3 miles of microscopic tubules. So there's such a complexity in our mouths. But so that system, though, that signals the endocrine system to produce the dentina lymphatic fluids, that gets suppressed, that signaling system, through high sugar diets, lack of minerals, or through stress, hormonal stress, or chemical stress.
So what are some of the consequences of high sugar diets and stress and things like that? What happens to the mouth? What happens to the body now that you understand this new mechanism?
Yeah, so, the spikes in blood sugar will eventually erode the communication of this lymphatic dentinal system. And so then the teeth become more vulnerable because they're not having this fluid going through the tooth in the right way and then flushing things out. So that can happen. And then once a cavity happens, then you could be on a route to, a root canal or something like that, or just a cavity. And these things we want to prevent as well. The other thing that we're doing a lot, whether it's specific dental treatments or specifically the way that we're taking care of our teeth every day with a wide range of chemicals, now that there's been in the past 2 decades more research into the microbiome, the body's microbiome, we now have a lot more information about the mouth's microbiome. And so, many of the daily ways that we've been told to take care of our teeth are filled with chemicals, and this also suppresses the activity of the mouth's microbiome. So whether it's chemicals that are mutating or literally killing off beneficial bacteria, things like triclosan, chlorine in our water, the various ingredients in toothpaste like sodium lauryl sulfate, that also makes our gums.
What does that do, for instance?
Well, that makes the gums prone to bleeding. And so then that's also, so you got more stuff entering the bloodstream, and then you're also throwing off the mouth's microbiome. So like if you look at something like strep, which is a bacteria that everybody has in their mouths, and strep causes cavities. However, not everybody with strep is getting cavities in their mouths. So what researchers are now understanding is that through losing bacterial species, we are getting rid of bacteria that keep other bacteria in check. So it's not necessarily the presence of strep in the mouth, but strep that's kind of missing its ancient bacterial buddies, so to speak. And so it's not having the other beneficial bacteria that can just keep things in check. So we really have to think about, all the things that we're putting on in and around our mouths to keep the beneficial bacteria happy.
What about people that breathe a lot through their mouth versus through their nose? People that have dry mouth a lot, lack of saliva, things like that.
That's definitely something you want to take care of, especially with children, because the development of their face will actually be different if you're mouth breathing. So yeah, you got to look at, if it's sort of structural, then you may need the help of an osteopath or a chiropractor. To maybe there needs to be a skull sort of adjustment or something with the neck with the proprioceptions off. And there are also specialists that specialize in TMJ and myofascial structure. And there's many therapists that also do Skype calls and sessions so that there's exercises you can do to take care of that. It could also just be allergy related. Maybe it's not like a really obvious allergy, but there could be a sensitivity to dairy that is creating more mucus, that is creating that kind of mouth breathing. So you may need to sort of look at, an elimination diet that can be easily Googled. And that's just about weaning off things like sugar for a few days, testing that, just seeing how you feel, and then, move through dairy, soy, kind of all the big sort of allergy areas for people. So you definitely want to take care of mouth breathing, not only for the structure and for the health of your body, but also so you don't have things like dry mouth, because we really do need the saliva to lubricate our mouths, take care of the microbiome, and also it's bringing nutrients to the teeth as well.
So what are some of your recommendations, or what are some of the products you've created that will help people?
Well, generally I like people to think with these three things, which is stop, seal, and seed. So for stopping, you may have to reassess, for example, the mouth breathing that we just talked about. And you want to look at stopping things that are dentinal lymph suppressors, like a high sugar diet. You also want to look at things like if you've got mercury fillings in your mouth, and you want to stop using synthetic dental products. For example, just a classic mouthwash, that's in the drugstore. Those kind of mouthwashes have been studied to show that they create 36,000 cases of mouth cancer a year, oral cancer a year. So there's other things in there that aren't so good. You don't want to be brushing with triclosan, which is like an antibiotic that will suppress healthy bacteria as well. It's actually, triclosan's been banned in hand sanitizers, but not yet in toothpaste. So that's kind of interesting. So you want to.
What are some of the things in mouthwash and toothpaste? You mentioned sodium lauryl sulfate. What are some of the other components of toothpaste or mouthwash that cause problems in your mouth?
So it's like the synthetic alcohols in the mouthwash, sodium lauryl sulfate. There's often the abrasive level of toothpaste can be quite strong with the various additives that they add to create grit. There's also things like, the warning labels on toothpaste are interesting too, because they're like may be harmful if swallowed. And also glycerin is not good either. That might be in more of your health food store toothpaste. And what that does is it has an invisible coating on the teeth, and it doesn't easily rinse away. So this invisible coating doesn't allow the saliva to access the enamel and do its job. So we want to clear out. Yep.
Would it actually be healthier not to brush your teeth every day? Only periodically, and maybe brush them with Just a mechanical instrument, no toothpaste?
Well, I do find there's some really simple household items that actually really help the mouth and help alkalinize it. I do make tons of gorgeous and effective oral care products like toothpaste and dental serums for the gums and ozonated gels. However, anybody can just start right now with sea salt and baking soda, or you don't even need both of those. So I love baking soda. So if you just ditched all of your drugstore items right now and just use baking soda for the rest of your life, you would be way ahead of the game with that simple switch.
Why?
And
Because
anybody can do that.
You're brushing with a high pH solution. You're brushing with an alkaline solution.
Yeah, so the alkalinity is great, and you get that with sea salt or baking soda. And I recommend that people put a pinch of sea salt or baking soda in a glass of water and swish that through their mouth before they even start brushing. And then you can even do that after brushing. That's also a really good tip for kids too, because they're just not going to get all the plaque off their teeth because they don't have the skills to brush that diligently. And sometimes they don't have the motivation either. So that's a great thing to do. And then with the baking soda, you've got a very fine, low abrasion level. And that just really helps to clear off the plaque. And we do need that. I like to use a dry brush with a pinch of baking soda. And that's just will really help the mouth and along with the gums. There's also a really fun thing that was developed by Dr. Paul Keyes, and he was an oral surgeon, and he really wanted to help people prevent gum loss. So that's when the gums start receding off the teeth and the gum pockets go from a 1-2 to like a 7-8-9. And that's a very important thing to take care of. You do not want your gums to recede because the enamel under where the gum should be doesn't have it's not the same enamel that we have on the teeth part, the part of the tooth that's exposed. And so it's very easy to get dental cavities along the place where the teeth and the gums join. So I like to suggest that we want nice turtlenecks of gums around our teeth, and we don't want it getting into like a cowl neck situation or a V-neck. So you want to really keep that area happy. And it's very important too to brush the right way. So just like from the gum down, not up and down. And you don't want to apply a lot of pressure. Your toothbrush bristles should look the same 6 months from now as from the day that you bought it. You don't want these splayed bristles. And everybody needs to be brushing with a soft head. There's no time that you want to have harsh bristles for brushing your teeth. So that's also very important. And so the baking soda can just clear away the plaque. And, it's so affordable. Everybody has access to it. And that, will literally turn your mouth around and put it in a positive direction. Now, for a lot of things, you're going to want to have what I call the botanical biotics, which is where we bring in botanical extracts, which are the things that we put into our dental serums and our toothpaste so that they can be further activated and healing can take place a lot faster for things like bleeding gums or helping rebalance the bacteria in your mouths or get rid of, bad breath and that kind of stuff. So some of those beautiful botanical biotics are things that have been used for thousands of years cross-culturally and transhistorically, things like cardamom, tea tree, frankincense, rose, cinnamon, clove, frankincense, myrrh. Those have all have, some good track records of being used for thousands of years. And what's really interesting now with the study of the microbiome is that we now have scientific research that's showing why those botanical extracts, those ingredients, are also beneficial, because scientists now see that things like clove and frankincense, they have something that they call QSI, which are quorum sensing inhibitors. So these plant extracts prevent pathogens, So we've got the friendly bacteria, the beneficial bacteria, and the pathogens. And normally you want the beneficial bacteria keeping the pathogens in check. The pathogens float around in our mouths and our bodies, sort of like free floating plankton in the ocean, except when they gain numbers, when they can gain traction due to like a weakened microbiome, a weakened immune system, then they start to do something called quorum sensing, which is how they gain traction, gain numbers, and start to express their genes. So the botanical extracts that I mentioned, they all have the ability to inhibit this quorum sensing. And they're also able to bust through biofilms in ways that antibiotics cannot always reach. And there's not the problem of antibiotic resistance. Plus, many of these botanical extracts are also really great at, cleaning up the pathogens, but working with the beneficial bacteria, which is so ideal for our mouths. So then we can take care of the pathogens, but keep feeding the friendly bacteria. And so with
what botanical extracts are these? Mouthwashes, or what? How do you consume them or use them?
Yeah, so the all the ones that I've mentioned, like frankincense, clove, cinnamon, etc., how we use them in like toothpaste, for example. So we'll put those together with other classic ingredients like baking soda and clay or charcoal and make paste out of that. And then for our dental serums, we run those ingredients through ozone, and then we make an ozonated gel. And then we also have what we call dental serums, which are very concentrated drops. It's liquid. And with these dental serums, one's called Happy Gumdrops. We've also got a mint and myrrh one. So these, you can add a drop to your water to freshen breath. You can add a drop to your toothbrush along with your baking soda. You can massage them along the gum line. You could add them to water. And then we also have a syringe that you can use. It's a blunt tip syringe. And then you can get these serums up into the gum line. And another fun thing to do is to take one drop of the serum, slide it along a piece of floss. And then when you're flossing, you're able to deliver these potent quorum sensing inhibitors to the tiny spaces in between the teeth, which is also beneficial to gums, especially if when you floss, your teeth bleed. And that's all part of the sealing phase of the stop seal. So these extracts and things like baking soda can alkalinize the mouth. They can help to seal the gum. They can be used as swishers to, when you're using, instead of using a classic commercial mouthwash, you can add them to water with your pinch of baking soda. Then you're alkalinizing and freshening your breath. Baking soda is also good for whitening. And that's part of the seal and heal. And then the seeding phase is when you're also introducing beneficial bacteria back into the environment. So I like to think of the body and the mouth as sort of this bacterial bank account. And you want to keep this system of bustling bacteria alive, and you want to have sort of diverse investments in this bacterial bank account. So things you can do would be like you can swish with probiotics. You can add that to your mouth swishers. You can do oil pulling with probiotics, and also taking things internally like a probiotic supplement and eating fermented foods like sauerkraut and kimchi are also going to be beneficial for the mouth and gut.
Oh, why would sauerkraut and kimchi? Interesting. Why? Because they just happen to have beneficial bacteria that the mouth likes, or
yeah. So there's a lot of probiotic activity in there, and so when our guts are happy, that's also going to create a happy mouth, because the gut microbiome and the mouth's microbiome are completely interconnected. So we want to think of feeding both those systems. And then what's also fascinating is that probiotics, they've done a lot of studies on that in dental care. And again, so you can take the probiotic supplement, which like the different bacteria you're getting, but also know that, a bottle of kimchi is going to have a variety of probiotics in it as well. But there's different studies been done with a variety of lactobacilli and also bifidobacterium. and they've all showed that they have the ability to adhere to the saliva, inhibit the proliferation of periodontal pathogens, and they've also been studied to show that they reduce cavity-causing bacteria and plaque.
How does the mouth microbiome interact with the gut microbiome? Do you know any scientists that are working on this, or what's your understanding of it?
Yes, there are tons of scientists working on this, and they're completely connected because they actually, they even share the same system and canal. And whatever we're entering into our mouths will go to the gut. So it's important, to eat right as well, because that the main way to keep your teeth healthy too is to have a diet that's rich in fat-soluble vitamins and minerals and whole foods, and that's what the gut likes as well.
Yeah, if you think about it, the bacteria in the mouth, I guess, get first crack at the food. Some of them, well, probably a lot of them get entrained with the food and move down the alimentary canal.
Exactly.
I wonder what kind of signaling there is back and forth. Any thoughts there?
There is a signaling. There's signaling even from the vagus nerve. So then that's the superhighway from the gut to the brain. So there is full on signaling going on all levels at all times within the body. And just like even the gut microbiome is connected to the skin's microbiome, but through a bit of a different way. But also the pathogens that we have in our mouth, and this is what makes the mouth such a perfect mirror for understanding the health of the body, whether it's like the mercury fillings, which are releasing mercury vapors 24 hours a day, 7 days a week, whether they were put in 20 years ago or yesterday, that feeds the heavy metals, feed the pathogenic bacteria, or whether there's a root canal in the mouth, which is invisibly sending pathogenic bacteria into the bloodstream every day. These things also further highlight how the mouth's microbiome is connected to the gut and the bloodstream, because whatever's going into our mouths is being literally swallowed into our bodies every day.
So of the products that you've created, what are some of the results that you're targeting? What specific effects do you want to have on people?
We want to help with their alkalinity. We want to help with healing and sealing the gums so that they're not bleeding, so that they've got that good, healthy pink flow, so that the gums are not receding. We want to help with whiteness. We want to help with the bacteria that cause bad breath. We want to inhibit the quorum sensing of pathogenic bacteria. And we want to arrest or cease the development of cavities.
So what are some of the effects that you've gotten anecdotally from customers?
Well, anecdotally, we've had it all. We've had people's cavities turn around. We've had cavities cease. We've had people heal their bleeding gums in 24 hours. Some people it takes longer, but some people apply the serums and then they're not bleeding when they're flossing the next day. We've had tooth sensitivity cleared. We've had whiteness get whiter. We've had people just go to their dentist. So many people go and they're like, I don't know what you're doing, but keep it up. So people are having cheaper, shorter dental visits. It's good. We get beautiful emails every day.
So where are you taking this? What's your goal? Over the next 6 months or a year, a few years?
I can't say I necessarily have a goal in this area. I've written the book. We've created beautiful line of products that are effective, and it's all on the right path. I'd say it's happening. It's active. It's a fully realized goal already.
That's great. Are there you mentioned one simple thing people can do is like brush, for instance, with baking soda. Mm-hmm. I was thinking about sleep. If hopefully we sleep for 7-8 hours, but if you just prepare the mouth before you sleep, at least you'll get 7-8 hours of a better mouth environment. So if you do nothing else, maybe swishing with bicarbonate before you go to bed, or like you said, sea salts, maybe that would help you at least get on the path to a better mouth.
Absolutely. That would totally help. And on our website, first of all, anybody can call or email us, and we're happy to answer any question at all. And we also have free half-an-hour consultations. So you can email us for that. We also have articles on our site from, how to find a good dentist. And also I've developed these 8 steps for successful oral care. So you can follow those. You can use them with our products, but we've also got the steps so that you can literally just do the steps and plug in with baking soda. Because I'm also, I love what we've created, but I also just really want people to know that they can really turn their mouths around by buying some baking soda and following the 8 steps.
What about unanticipated effects or results? Anything that is happening with people that really surprised you?
Not really. Just I just love when cavities actually, they can cease and start healing again, because that's what a lot of people don't know, is that the teeth are alive and they will respond to our efforts. I know I certainly grew up thinking, okay, you got a cavity, that's it, fill it, done. The teeth you got your adult teeth, that's it. But the whole system of the mouth is alive. So the gums are alive, and that's flesh that can respond. Just like if we get a cut on our arm, the skin will heal around it. And the alkalinity of saliva can get turned around very quickly, and the strength of our teeth can get turned around. So I just want people to know that there's definitely, wherever stage their mouth is at right now, there is hope, and your mouth will respond to these better techniques.
All right. And what's the best way for folks to find out more? Where can they get your book? Where can they get in contact for a consultation?
Well, our website is livinglibations.com. So hop on over there, and then you can peruse the site or give us an email at sage@livinglibations.com. And my books are on there. I also have a new book called Renegade Beauty, which is over 400 pages on how to reveal and revive your natural radiance. Lots of stuff in there. And there's also a very comprehensive dental chapter as well, with some new information. And then I've got the holistic dental care book. They're available on the site, also on Amazon. And the 2 books have now just become audiobooks. So they're also available on Audible.
Very good. Well, Nadine, thank you for coming on the podcast. And it's super interesting stuff. So I appreciate you being here.
Yeah, thank you so much.
You're listening to the Future Tech Podcast with Richard Jacobs. Future technologies such as artificial intelligence, stem cells, 3D printing, gene editing, Bitcoin, blockchain, the microbiome, quantum computing, virtual reality, and exploring space are much closer than you might think. In fact, many early versions of these technologies are in play right now, and the companies that are using these technologies are the focus of this podcast. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a thorny medical problem. Remember, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you've enjoyed the podcast, please listen, subscribe, like, and tell your friends about it. Thank you.